Hello and welcome to Pisgah Health Today. My name is Angela Owen. It is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals who are committed to improving the health and wellness and lives of Western North Carolina residents. Our special guest today is Shelley Webb, who is the Executive Director of the Sharing House. Welcome to our program today, Shelley.
Thanks. I'm glad to be here.
Shelley is currently serving as the Executive Director of Sharing House. She is responsible for overseeing and advancing the vision, ensuring the programs are professionally designed and adequately resourced. She is also available to tell the vital stories of the Sharing House to congregations, small groups, businesses, and civic groups. She is an ordained minister in the United Methodist Church. She has worked extensively in ecumenical and interfaith ministries. And we are so excited to get to talk with you and learn more about what you do there at the Sharing House. So why don't you start by just telling us about the Sharing House, the organization, and what you do to serve the people in our community.
Yeah, well, we are just an amazing nonprofit that has, it started 40 years ago, nearly almost. So we're excited to be coming up on our 40th year anniversary, but it was founded by several congregations, people of faith in our community who believed that they could do much better together than any one individual congregation could do alone in serving the needs of low-income residents of Transylvania County. So they garnered their resources. They've put up volunteers. Today, we are nearly about a $2.5 million organization that gives that kind of aid to the community. And it takes, under normal circumstances, not COVID time, but normally 130 volunteers a week to operate the Sharing House. We are a food bank. We are a clothing service. We give out hot showers. A lot of times people don't even know that we do things that people aren't really aware of. But the biggest contribution we help people in need with is with financial assistance for rent and for when people have eviction notices or utility cutoff notices. We can try to help people keep in their homes with the basic necessities of life. We also do empowerment programs where we believe that we're called to walk alongside people when they want to garner more resources for their lives, whether that be through education or through learning how to budget, or sometimes people need wheels, so we call it Wheels to Work program, reliable transportation to help them obtain a job and to keep employment. So those, that definitely necessitates having a living. You got to have reliable transportation to get to and from work, as well as to enhance your family's life too. If you want, your kid enrolled in Little League Baseball, for instance, some social interaction, Boy Scouts or Girl Scouts or what other, club activities that happen after school. Oftentimes you don't realize what a barrier that is for your family if you don't have reliable transportation. So all of that contributes to a healthier, well-being life for our people. We serve about 20% of the population of Transylvania County. We serve folks who are considered working poor to those who live in abject poverty. Oftentimes, the one myth that I like to really highlight for folks is that 80% of the people we serve are actually employed. They are working individuals. So that tells you the struggle that people have just to make ends meet in this part of Western North Carolina. It's just difficult.
Mm-hmm. It's incredible to hear all of those services. I would dare say that the average person on the street who thinks they might know about Sharing House probably has one or two of those dimensions, but there are so many facets that you look at to keep people together with dignity and to help them, whether it's feeding their families or clothing them or helping them stay in their places where they're living right now, as you highlighted with the rental assistance and such. Shelley, talk to me about the grant that you guys were awarded from Pisgah Health Foundation and what it is allowing you to do specifically in service to the Western North Carolina residents.
Yeah, well, one of the things that we made as our own goal for our organization was to get to know the people we're serving in real ways, to be in relationship. So, for instance, we never call people clients here at the Sharing House. We call folks neighbors because that's what we are, one to each other, and that implies a relationship. So when we listened to our neighbors, um, with their desires and hopes for their own well-being, what we've heard from them is that they wish they could afford fresh produce and vegetables. um, and what often happens with with food stamps or SNAP benefits, um, sometimes they can stretch it out, but in order to stretch out your budget, your dollars, you end up buying the second best thing. If you can't get fresh, would be frozen. But if you can't get frozen because you can't afford it, then you get canned vegetables. So you can imagine every time you process that food, it's got less nutrients in it. So what we heard is that people wanted more fresh produce and vegetables. And our statistics showed that we would have just regular donations that we usually get through Food Lion. We're dependent on whatever they have that day, left over, ready to give to us. We try not to waste any food in Transylvania County, or Ingalls sometimes, or whoever might have Manna Food Bank. We gave out that produce. You could come once a week for fresh produce and you would get a grocery bag full of produce, and they would self-choose out of the refrigerator what they would eat or their family would eat. But oftentimes it's on its last leg. It's got a little moldy strawberry in the package of strawberries, etc. So what we desired and what they told us they wanted, was that we could purchase produce that was not on its last leg, but was, that could have at least a 4 or 5 day shelf life in their refrigerators. And so we dreamed of a grant through Pisgah Health Foundation to bolster people's nutrition, knowing that they would choose it because we know that it's visited over 700 times a month. Sorry, 700 times a month. So that's what we've been doing. And lo and behold, we had no idea that the pandemic was coming, but it's turned out to be just an amazing gift to the community. We order every Tuesday, every Monday, we get an order of fresh produce right off the truck. They come and they deliver it to us. We have a crew that comes in on Monday afternoon. We put out 160 to 170 boxes of milk cartons. We load it up with fresh vegetables that our neighbors have chosen. Like, they will tell us, what we really want are cucumbers, or we really want lettuce because we want to make salads, or we really could use pineapple or more fruit. And they get they get opportunity to give voice to what they really desire. Strawberries. When it was around July 4th, people wanted watermelons. So with the grant, we were able to order the vegetables and fruits that people wanted and desired, and it's consumed. I mean, we've had reports, and this makes me so happy, along with exercise, I should say, but some of our folks are determined to be healthier. Obesity runs high in low-income families, especially children. So we're trying to help make choices easier. If you don't have an excuse anywhere that you can't afford it, when you can come to Sharing House and get a fresh box of produce. And we've heard that people have lost 50 pounds. They've gotten off of medications for diabetes. We have heard, people taking risks of trying new kinds of fruits and vegetables to see if their kids would eat it, and the kids love it. So it's just been fun. It's been fun to watch people's joy. We've been doing the drive-through every Tuesday for an hour. We serve over 160 people usually, and it's just been fun to watch. And we make it into a party. On Tuesdays, we have a person who comes and she just totally enjoys herself as she's we take only the number of household, how many boxes per household. So that's the only tracking we do. and people just come out in droves. It's been fun.
I love it. I love hearing all those stories. You're not just feeding people, but you're helping them to live a healthier life, and you're listening to what they're asking for, and finding those solutions, and working with partners like Pisgah Health Foundation to secure funding and such to be able to do that. So, wow, what an incredible, I would love to hear, like, just what is something that you can share from a story standpoint of someone that's come through, a neighbor that's come through,
Mhm.
a family that's come through, that you've just seen the impact and they're out in the community beaming because of what they've been a part of through the Sharing House?
Yeah. Well, you can imagine with the COVID crisis that has happened. And right at the beginning, around March and April, we had several people in that limbo time where they were laid off kind of quickly, or they were self-employed. We had hairstylists, we had massage therapists, we had yoga teachers, we've had small business people who did not know how they were going to make their ends meet, and people who've never had to ask for help before. They knew that they could go through the drive-through of our produce line and receive fresh vegetables that they have, that they really desired and needed at the time. And I'll never forget the one day where someone drove through and just in tears, like, I don't know if you can say that, like a pineapple. I remember we had pineapples that day, and it's just so pretty when it comes out of the box. But and and it's hospitable too. It's like welcome. That's the symbol of a pineapple. But everything had gone wrong in her life for about 2 weeks, and just the fear that COVID was, initially we still don't know. It's still a very scary kind of proposition. But at the beginning, we were just scared to even get out of our cars. And she came through, and just the idea that somebody cared enough to hand her a box of produce when she had never faced such crisis before was just the relief she needed in that moment. And it was just all over her face. And sometimes, people will say thank you. Sometimes people are moved to write us thank you notes, and this person sent us the most heartwarming thank you note. She did not have to thank us or Pisgah Health Foundation, because we're here for her, but you could tell it made an impact more than just what it gave to the body, but to the spirit.
Oh, which is such an important part of us being healthy, is to be able to put into that spirit realm the joy and some hope, bringing some hope,
Yeah,
sometimes in the form of a pineapple, like you said there, right? To be able to
exactly.
show that happiness and hope. Well, for those who are watching, if they want to support or help in the Sharing House in some way, what would you have us to do?
Yeah, I still think the best way that all of us can help one another is to continue to practice safety. um, I keep saying, we're still on the front lines here at the Sharing House. We interact with families that struggle. A lot of our families are the ones that were on also the front lines. They're the grocery workers. They're the pharmacist assistants. They work in public settings like CNAs. And so what we can do as a community is continue to practice healthy ways of living during this COVID time, like wearing our masks and washing our hands and just social distancing. But also to think about others that are around you, especially those who are vulnerable, in ways that is beyond just yourself.
Mhm.
And I can tell you that our community, if I ever doubted it before, I can never doubt it again. But we are generous people,
Mm.
and that's heartwarming. And everybody, instead of all the dividedness, we need to think about what draws us in common with each other, and that is health and love and less stress and worry, and to be neighborly, to look after one another, to call up and just say, how are you doing? The loneliness has kicked into some of our folks, especially those who are homebound and living on very meager income. We call them. It's more than just the products we give out, but also the spiritual part too of let's care for each other. And um, find that sense of kindness. Be the good in the world. That's kind of our slogan this year. We want you to join us in that effort in the smallest ways. You might not be able to solve hunger, but you can look after one person. Or you might not be able to solve someone's financial crisis, but you can certainly be there around them and support Sharing House, because together we can meet those needs. And we're living proof. We've got a lot of people who know the touch of our community through the Sharing House. And I know I keep going on, but I will say one of the best things about the Sharing House is that we are a diverse people. Like every volunteer that works here, staff members, our congregations that support us, we all come from all kinds of beliefs and skin color and language differences, and some have grown up here, some haven't always lived here. And the beauty of it is that despite all those differences, we found the one common good, which is to love our neighbor as ourselves. And thank God we can do that together, because I need those signs of hope too in the days that we're living in, where the world seems so divided. This is one place you can look to say, we're all in this together.
Those are super powerful words, Shelley. I think it really says it in the name, Sharing House, and you're sharing that love for each other and drawing upon what you're connected about rather than focusing on the things that are perhaps the differences or the divisions. So thank you also very much for being a ray of hope and for giving to so many people in Transylvania County right here in Western North Carolina. Any final words for our viewers before we wrap things up here today? I so appreciate talking with you.
Well, I do want everyone to hear us say, on behalf of the people that we serve every day, every single day, thank you. Without you, we would not exist. Everything we give here, everything, is because someone chose to give of themselves freely to benefit other people. And that's enough to live on. The fact that we all live this life of gratitude. So thank you.
Well said. And thank you, Shelley, for your leadership there at the Sharing House, for all that you do, for taking time to be a part of Pisgah Health Today and our program. We also want to thank Wildflower Media for their creative and technical support, along with the staff and the board of directors at Pisgah Health Foundation, as well as the Physicians Roundtable, for all that these groups of people do to continue to help improve the health, wellness, and lives of Western North Carolina residents. Until we see you again on the next Pisgah Health Today program, stay well.